everyone. Thank you for joining us tonight. You are logging in for the Health Sciences Q&A session here at Newman University. Newman is located in Wichita, Kansas. We are a private Catholic college, and we are happy for you to join us tonight. Whether you already know what it is that you want to study in the healthcare field or you're still exploring, this is a great chance for you to meet some of our program directors and faculty, as well as our dean of the school, to see more about what might be a good fit for you and ask your questions about the application process. First up, this is me. I work in the admissions office. I'm a Newman University alumna twice over, and I've been working in the admissions office for about 10 years. I'll be kind of handling things in the background today, monitoring your questions in the chat. So if you think of anything that you really want to ask, put it in the chat, and I will be asking those of our program directors a little bit later. But before we get started with our program directors, here is our Dean of the School of Healthcare Professions, Jerry Tyrell.
Welcome this evening. I'm so glad that each of you are here joining us, taking some time out of your busy schedules. I just want to take a few minutes to really just welcome you, and so glad that you, one, have an interest in healthcare professions, one of our programs, and interest in Newman. And hopefully you have some great questions. I've already seen a few questions that have been submitted, and really I'm excited to engage with you. If you have questions for me, I'm happy to answer those as well. So we will move on to Tim.
Hello, everyone. My name is Tim Cho. I'm the program director for the Respiratory Care program here at Newman. And one question you might have is, as a respiratory therapist, we are specialized clinicians that deal with patients with cardiopulmonary issues. We're typically known as the individuals go into emergencies and codes and things like that, but we also do a lot of outpatient care in rehab facilities where we try to help individuals live their best lives and cope with their pulmonary disease as best as possible. We do fairly mundane things like breathing treatments and inhalers, but we also work on life support machines or mechanical ventilators to support those individuals that can't breathe for themselves. We deal with newborns all the way up to adults and geriatric populations. And so we kind of see everything from birth to death. We work on transport teams, shipping or delivering critically ill patients from one hospital to a larger facility so they could get the care that they need. One thing you may not have known is in respiratory care, you can complete your bachelor's and master's in respiratory care and work as an advanced practice respiratory therapist. It sounds very much like a APRN or a PA, and that is, those are, they serve similar functions. And the starting salary for that is around $120,000 a year. Our application pool or application period opens in February, and we take a class of 20 once per year, and we will continue to accept applications until we're full. It's 3 short semesters is the program once you have your prereqs done. So you start in fall, and the following fall you will graduate and be able to get full-time employment and maybe work while you're completing your degree. So I think I'll say this for everyone, or all the program directors here. Newman has a great relationship with the healthcare facilities in this area. And so we have the benefit of getting some of the best clinical experience in this part of Kansas. So respiratory care.
Next up is Jeff Bond, director of our next up is Ashton Clarkson, director of our nursing program. All yours, Ashton.
Thank you. So yes, I am the director of nursing at Newman. I am fairly new to Newman University, but I am excited that all of you are here wanting to get more information about our programs. A little bit about our program. We do accept about 35 students twice a year, once in the fall, once in the spring. And some things that might be a little bit unique, or that we kind of like to shine for Newman. We are working on really increasing our simulation for nursing students. I think we have a pretty fantastic simulation lab. It has 2 what they kind of considered intensive care unit rooms. along with a lab. And we have a lot of great equipment for students to practice with and to really gain those skills. And kind of to piggyback off of what Tim said, nursing is kind of the same with respiratory as far as, we deal with, birth through death. Nursing is very versatile. I mean, you can do something as far as outpatient work. There's a lot of nursing that can be done or utilized over the phone these days as well, along with working in clinics in the hospital, in the ICU, the ER, kind of anything you want to do as far as, a specialty. It can be done within nursing, and you don't ever have to stick with the same thing throughout your whole entire career. If you're, like, oh, okay, I'm getting kind of tired of what I'm doing here, there's always something else that you can try and something new. So lots of opportunities for nursing.
Great, thank you. Next up is, this time, Jeff Vaughn, director of our Rad Tech program.
Hi, good evening. My name is Jeff Vaughn. I'm the director of the Radiology Technology program. And our program is an associate's degree. We accept students once a year, every fall. As a start date, it is a 5-semester or 2-year program. You will go throughout the summer in between. But once you get to that point, you start rotating and going to different hospitals to do see different modalities, to just kind of get an atmosphere of what type of facilities are out there. Plus, most places where you go, the patient population is going to be a little bit different. So we take up to about 30 students per year, and our application process is going to open about the middle of January. But this year, I know Georgia's got March 1st. We've changed that for this next year. So we're going to be, well, actually, they do close March 1st. It was April 1st. Sorry, Georgia. But our minimum GPA is going to be a 2.75. But I do want to let everyone know that this is an accredited program in which it's important for you to understand what that means, because there are programs that could possibly be out there that are not. And usually you don't get, a lot of things do not transfer. So you do get the opportunity to go see different modalities, while you're in the program. But the Radiology Technology program is a stepping stone, so to speak, if you want to, or you can stay as a diagnostic technologist. You can go into MRI, CAT scan, mammography, interventional, all of that. So there's a lot of different modalities. So you're not just stuck doing one thing. And so a typical day, you may end up in the operating room, the emergency room, doing fluoroscopy exams, or just regular diagnostic x-rays. And so we're happy to have you here this evening. And if you have any questions, feel free to ask.
Thanks, Jeff. For our diagnostic medical sonography program tonight, we have Lindsay Harris filling in. All yours, Lindsay.
Hello, I am the clinical coordinator, so I am filling in for Brooke tonight. I'm excited that you guys have joined us. I was looking at a couple of your guys' questions already, and I'm excited to answer those for you. I've been doing clinical coordinating and helping out with the program for about 7 years, and this is just a wonderful sonography program. It's a bachelor's degree, so you're going to do your first 2 years of general education, and then you can apply for our program. Our application is changing to March 1st this year. So your application will be due by March 1st if you want to get in for the fall. Our program length is 5 semesters. So fall, spring, summer, fall, spring, and you will be rewarded with a bachelor's in diagnostic medical sonography at the end of that. We're accepting around 12 students right now. We have exciting changes coming, and we're adding potentially a new modality coming up soon. We plan on adding echo in the next year to our program. So not only will you be learning abdominal, vascular, OBGYN, there might be an opportunity for you guys to learn echocardiography too, which is very exciting. We have also gotten a couple new machines, which has been really exciting for us. So our lab has gotten bigger, and so that's just we're just growing, and it's very exciting. So our application will open the first week of February if you're interested in getting in for the fall of 2024. Our minimum requirement for GPA is 3.0. Most of the people that are accepted into the program have a little bit higher GPA. We also look for shadowing experience too. So if you are interested, I would reach out to one of your region medical centers like St. Francis, Wesley, Derby Rock Regional to get some shadowing experience. That's something that we look for in applications. But yeah, I'm excited to answer some questions and excited for you guys to be here.
Thanks, Lindsay. Jeff, did you want to take some time and talk a little bit about the Kansas Promise Act scholarship for our rad tech and respiratory care students?
Absolutely. So this is a scholarship that's been in process, being eligible here probably for probably within the last 2 or 3 years. And so this is a scholarship for students that have there's a kind of a timeline about it. So you have to graduate from high school within the past year or be 21 years or older. And some of that might depend on your military service so the only 2 programs that affects right now are Radiologic Technology and Respiratory Care. So you can see the some of the requirements down at the bottom. The good thing is if you get this scholarship, the key to this one is finishing within 30 complete the program in 30 months, which you will, because it's right now 22 months, and then Tim's is 3 semesters as well. So you should be able to complete that pretty easily. Now, the stipulation for this is they want you to work in the state of Kansas for 3 years after you graduate. So, and once you get this, it is a certain dollar amount for each semester for the entire time that you're in the program. So, if you don't mind, Georgia, I want to touch on this healthcare science as well.
Yes, please.
Healthcare science is a degree completion program for ones that are that are in respiratory care or the rad tech program. And so you end up doing a practicum and things like there's 5 core classes that you have to take, and then there's 3 other concentrations that you can choose from. CAT scan, you can choose from business, or you can choose from sociology / psychology. So so it's again, it's a degree completion program, and so I just wanted to touch base on that and let everyone know about that. When I say degree completion, it's getting your bachelor's degree.
Right, because respiratory care and rad tech are associate's degree programs. So in completing those programs, if you would like to leave Newman with a bachelor's degree, healthcare science is a great option and designed specifically for that. All right, thanks everybody for that brief intro. If you are on today's Zoom and you want to screenshot or save contact information for any of the people on today's Zoom, they're all on the screen with names, titles, programs, emails, and phone numbers. They're great people to contact either to set up a visit or maybe just to ask some more questions as you're exploring different programs that you might want to apply to. We are going to move into some open Q&A. The chat is open in Zoom, so if you want to go into the chat, you can ask your question. We will be weeding out some just duplicate questions that maybe different people ask. I did have some submitted in advance on our RSVPs, so I'll go ahead and ask some of those. Can each of you talk about maybe any accreditations that you have for your individual programs?
Yeah, I mean, I can talk about nursing. We are accredited through CCNE, which is one of the accrediting bodies for nursing. We were last accredited in 2019, so our next accreditation visit will be in 2030. And so, like Jeff had mentioned, you definitely want to look for a program that is accredited, just for if you want to go on to school further, and also, getting a job, that sort of thing. Sometimes they do look for that accreditation kind of body.
I can talk again a little bit about the Rad Tech program. It is again, it is an accredited program, and there's so on our on the Newman website there are some things that they want us to post. As far as the first time pass rate, we have to keep that running for every 5 years. How many people graduate, your attrition rate, how many your let's say pass the certification exam the first time, and the one I want to key on is really jobs when you get done. For the past 3 years, there's been 100% of our students have gotten jobs, and that's probably within all of our programs, getting jobs usually before they even graduate. And a lot of times uh, when you do your clinicals, uh, they understand if you're doing, they may even offer you a job at your clinical site just for the fact that they know what your work ethic is. And they, if there's a position available, that's a good chance they're going to offer that to you. And so it's really nice to understand a lot about this. We're accredited by it's called the JRCERT. So, and you can go to that. It's on our website. And so if you want to look at any of this information on our program, so you can do that as well.
The Respiratory Care program is also accredited. It's accredited by COARC, the Commission on Accreditation for Respiratory Care. If you're interested in doing respiratory care, you have to go to a accredited program. That's the only way you can sit for your boards or your credentialing exam, and you need to do that in order to get your license, generally speaking. So the only way you can get a job and work as a respiratory therapist is to do a accredited program. And the point of accreditation is to protect the public, the students, to make sure that you're getting a quality education that will help you become the therapist that's valuable to an employer and that's safe to the general public. So that's respiratory care.
Thank you.
Well, can I just mention, sonography? It's not sonography itself is not an accredited program, but it doesn't have to be, because it's not using radiation. So you end up with a lot of, you're using sound waves to actually get your images. So don't think just because it's not accredited, there's very few in the United States that's actually accredited. But you graduate, you're still able to sit for their boards. And Tim mentioned about state license. I just want to make everyone aware that there's a difference between your certification exam and getting a state license. Okay, so they're not one and the same. So you have to end up doing both. Okay.
Yes, I wanted to piggyback on that, Jeff. Because we offer a bachelor's degree program in sonography, we fall under a different prerequisite for the ARDMS, which is our accrediting body, American Registry of Diagnostic Medical Sonography. So everybody is still board eligible once they get through the program, and we have, of course, 100% job placement too. So a lot of the sonography programs that need to be accredited only offer a certificate or associate. So that is the difference there. I know that was a question someone had.
Yes, thank you for addressing that.
Mm-hmm.
Let's see. I think you had mentioned this already, Lindsay, but maybe go over it just one more time briefly. Are there any recommended places to do a job shadow for sonography?
Yeah, I've gotten this question quite a bit in the last couple of months. So from what I have been hearing from people that are job shadowing, I know that Derby Rock Regional allows shadowing. Wesley and St. Francis also allow shadowing. So I would just get in contact with the sonography department there, and they will let you shadow for half a day or so, maybe even up to a day. I know Derby Rock Regional lets you shadow, and it's getting better. During COVID, it was a lot harder to get shadowing opportunities, but now that we're kind of getting through that, a lot of people are opening up to potential students, and they'll be open for you to shadow.
Thank you.
Can I piggyback on that just a little bit?
Yeah.
Just for radiology, they do allow that as well. And for all of our programs, if you have the opportunity to go and shadow someone and kind of find out exactly what they do, a lot of times it looks good on paper, but then you get there and it's maybe not what you thought it was going to be. So I encourage all of you to go to take that opportunity and go shadow someone.
Jeff, the next question is for you from one of our rad tech interests. What is the application process like to get into the radiology program? And maybe in addition to that, what type of applicant are you looking for?
Okay. Yeah, like I said, it's due March 1st this time, and what our goal is to, we do the interview process after that, and we take everyone that has a 2.75 GPA, and we offer them an interview process, and every student is asked the exact same questions. We try to be as fair as possible. When you actually do submit your application, there is an essay that goes with that. And on the application, it kind of tells you what to write about. And so we kind of take that into consideration. We're very big on communication, which I think most of our programs are, because you end up having to talk to your patients. And so we do have people that they worked at, at restaurants as a waitress or a waiter or anything like that. Don't discount that, because that is very key on as far as the communication piece of it. And so once they get, we conduct the interviews. We usually do those in person. Anytime you come to that interview, just make sure you dress you're going to a professional interview. Okay, so and then once we get all of that, we have a rubric that we grade every student on. And then once, and because when you do the interview, it's with 4 faculty. It's like a panel interview, and it's usually lasts about 20 minutes or so. And then once that happens, we just we add everything up, and we just go down the list about the top 30. And then, but one thing I do want you to realize, that you may be taking courses, still while you do the admission or the application process. But I encourage you, for all of our programs, to go ahead and submit your application. And so that way that we'll go through and we'll evaluate, what your GPA is, even though you're currently taking courses. For the Rad Tech program, we actually allow you through the summer to finish everything, as long as everything is done by then, before the fall semester starts. And so I encourage you to just talk to the program directors, and to and kind of get a more in-depth knowledge about what that process looks like. We do not require a lot of people ask that, do we have the TEAS test, and we do not have that. And so we have like 6 prerequisites courses, so it's not a lot of them, and so you can actually get through that. So again, we kind of touched on a little bit about the type of applicants we're looking for. It's not always, we've had some that, they kind of struggle through a little bit, but then they end up making some of the best X-ray techs out there. So, so I encourage you to, not just that, but encourage you, if you're, depending on how far along you are in the process, you might can apply for sonography as well as the Rad Tech program, because both of them are considered in radiology because radiology, the term is just kind of like a general term. But just in case, because we don't always accept the same number of students, so we just don't want the students to get left behind. So just also as a reminder, you don't have to be an X-ray tech or Rad Tech to go into sonography. So you can do that. We think all the faculty that are in sonography are X-ray techs as well, but it's not a requirement. So I just want to clarify that.
Thank you. Ashton, one of our nursing students has asked, what type of orientation or training do you provide prior to clinicals, or to get them ready for the clinical experience?
Okay. So when you start off, our program is 4 semesters long. So when you start off in your first semester, there is 7 weeks that you are in the lab before you even go to a hospital. And during that lab time, what you're really working on are some different skills that you are learning and talking about in class. And so you have a chance then to practice a lot of those skills. They do things from, practicing medication administration, documentation, and like Jeff said, that communication piece as well, and getting you ready for clinical. And then after those 7 weeks, you'll do 8 weeks in a hospital setting. And you'll also do some simulation along with that during your hospital rotation. And so that's kind of the first semester. And then second semester has about 4 weeks of lab preparation that you're going to do prior to going to clinical. And those are just other skills that you're going to learn in your second semester. You may work on practicing some other skills from your first semester as well, just to kind of refresh. And then you'll go to clinical for you'll have 4 weeks of like a med surg. You'll have 4 weeks of mental health. And then you'll have a 4 weeks that'll be incorporated with some simulation in that semester as well. And then in our third semester and fourth semester, you have a little less preparation because you have learned all the skills. And so you're more ready to get going in clinical. What we're looking at doing here this next semester is doing a boot camp. Like the very first couple of days of the semester. And that boot camp will provide opportunities for students then to practice some of the skills that maybe they learned in first semester and just haven't had a chance to do for a while. And just kind of give a refresher, kind of get up to speed before you start then in the clinical area.
Thank you. Jeff, we had a question in the chat for Rad Tech. Does the school accept credits from the military for Rad Tech, and is the school accredited by ARRT and JCERT?
Okay, so it is accredited by JCERT. The ART is not the accrediting body. That's who we get our credentialing that provides the credentials exam for us. And so we do accept credits through the military. Sometimes when they come in, it may say something different than what we actually call it. But our registrar's office is very good about, her name is Sandy, and she's very good about. She kind of works with the military as well, and trying to make sure that those credits, what they are, can transfer in. So, absolutely, we accept. I have it every semester. I have veterans usually come into the program. I even had some that are, in the Guard or the Reserve. So we kind of work with them throughout their program. We understand they have to go for their 2 weeks if they're in that, if they're doing that, and we'll work around that. So don't be afraid of of things not transferring. So a lot of it does transfer.
Thank you. Ashton, I have another question from a nursing interest. She was told by word of mouth that her clinicals that Newman prefers students have experience in healthcare, like CNA or CMA, but would Newman count being a medical translator as experience? So is it true that we want medical experience, and is medical translator valid? Is it, something you look for?
Medical experience is always good, but it's not something that is gonna make or break getting into nursing school. And I think being a medical translator, that's something that we would take into consideration. But we really don't put those who have medical experience above those who don't, because what we find sometimes with people who come in with medical experience, they've learned bad habits kind of along the way. And so, sometimes it's good to just kind of have a fresh start. And I realize that not everybody has, the opportunity to have medical experience prior to coming into nursing. And so I think maybe in the past that is something that has been taken into consideration, but we are, starting up some new things, especially, with our interview process and application process. So that's not something that we hold very high within that application.
Thank you. I have a student in the chat asking if they took anatomy and physiology online, would that count for credit for the A&P requirement for Rad Tech or any of the other programs, or is that something we prefer they retake?
Well, I think for radiology, we would take it. Now, the biggest thing that you have to be aware of, the classes might be online, but then maybe the labs. It's kind of, I know we even offer the anatomy class and the anatomy lab online here at Newman, but the physiology piece of it plus the lab is both in person. So it's not like I said, it's not always necessary that it be in person, but the physiology piece might help to be it, but it's not going to be a backbreaker getting in or not if it is online.
Can I jump in on this one real fast?
Go for it.
So it doesn't, I would say for all of the programs, it really doesn't matter if it's online or in person. What is going to be the key determining factor is that it comes from an accredited institution. And that's going to be really determined from our registrar's office. And so that wherever you took that course at is an accredited institution of higher education. So that would be the important part, is that they do have an accreditation status at the time that you took that course. So if there's any question about that, you can reach out to our registrar's office. You can feel free to reach out to me. I'll be happy to look into that for you and work with you on that. But yeah, it really doesn't matter if it's in person or online. But it is really that they are an accredited institution of higher education. So
Thank you.
And
Ashton, another one for you. You're a popular one tonight. What does the interviewing process look like for the nursing program?
You have an application that you fill out. We also require 2 references to be turned in order to make that application process complete. We do allow 6 hours of outstanding credit to be completed, but that does not include any of the prerequisites that we consider for nursing. So that would be really all of your sciences, math, and that includes statistics as well. So you have to have all of those completed prior to entering the program. And then once we have our candidates, then we set up interview times. We have 2 faculty that interview each candidate. That interview will last about 30 minutes. We also have a set of questions that we use for every candidate that comes through. That way it's fair, like Jeff was saying, for Rad Tech. We also have a rubric that we use to score each candidate, so it is equal among the candidates. We also have a math section that will have you do some basic math. And then we also have a writing section as well, just to see how you're writing and so forth, and those are both scored as well. And then all those things are included into your interview score. And then, as Jeff was saying as well, we just take those that are at the top, and we take then the first 35. We usually do have a small wait list as well, because sometimes students decide that maybe they don't want to start right now, or they do want to go somewhere else, and that's okay. But then we would call you if you were on the wait list. So that's kind of how our interview process goes.
Thank you. I think we kind of touched on this, but Lindsay, we have a sonography student wondering if they're not able to take one of the required prerequisite classes until the summer. If they show proof that they will be taking it, can they still apply for the program this spring?
Yes, as long as it's done and a passing grade through the summer, we will accept it.
Thank you. Let me see. Nursing, besides a good GPA and meeting the prerequisite requirements, what would you recommend for a student to really stand out in the interview process? Like go above and beyond?
I think that communication piece is big, along with dressing, professionally. I've done a lot of interviews. People come in jeans and a t-shirt. That's just not appropriate for a professional interview. And two, also understanding what nursing is and what we do as a profession. I think that's important to help you, stand out as a candidate as well. Those are kind of the things that we're looking for those that apply.
Thank you. And the last question I have in the chat for the sonography program, what does the interview process look like and what kind of applicants are you looking for? What makes somebody stand out in the sonography process?
Sorry, I was muted. Oh, so I would definitely say patient communication is huge with sonography. So someone that can really communicate in their interview process is definitely a standout for us. Again, medical experience is great, but not required. So I don't want anybody to feel like they can't apply because they haven't had medical experience before. Again, like Ashton said, sometimes that can actually be a hindrance, and so it's not necessarily, it can also be very good, but it's not necessarily something that is a standout for us. What we're really looking for is someone that can be professional and communicate and a hard worker with integrity. So those are some of the things that as this next class is coming up that we really want to focus on. How our application process works is the person is going to apply by March 1st, submit their grades. If they have any outstanding classes, let us know and get those documented. Then you're going to have a couple of references, write you a letter. After that, we'll go through the applications and the people that do meet the requirements, we will interview in person, and our sonography faculty will interview. And it's kind of like the same thing, some standard questions, but also like, why do you want to become a sonographer? What kind of research have you done into the sonography field? Do you know what a sonographer does throughout the day, just to see where you guys are in that? And we also look at how your appearance is, how you are holding yourself as a professional during that. Again, t-shirt and jeans is probably not the what we want during a professional interview. So we want your appearance to be professional, and just good communication is huge. Once we get the applications in, we also do it's from Pegasus. It's a test that's basically a hand-eye coordination test, almost like an ink block test. And you can't really study for it, but there has been studies that have shown that if you score higher on this test, you tend to be able to pick up sonography as a skill easier. Now, this is not like a telltale thing. Like if you score lower on the test, we're definitely not going to accept you. It just kind of helps us look at where you would be. Is this going to be a harder skill for you to get? Is this going to come easier for you? So it's more of knowledge for us. And so once all of those, all that information is together, we go ahead and we pick our top 12 to 14, and we will extend an offer for the program that will start in the fall.
Thank you. I have one more question, and then I'm going to launch into some admissions information. For Rad Tech, do they need references as part of the application process, and how many?
For the Rad Tech process, we don't require any references to get into the program. So, but Georgia, real quick, if I could just touch on, I encourage everyone to come to Newman and come and see us, and come to see our classrooms and our labs, because We have top-notch labs. I mean, even for radiology, we've got a digital machine that you can actually take x-rays on. Obviously, we don't take them with each other, but we do have phantoms that we take them on. So you get some firsthand experience before you actually get into out into the healthcare setting. So please, feel free to contact us, and we'll be happy to kind of walk you through and show you around.
Thank you. I was just looking, we have students from a range of different majors and terms and schools. I mean, we have students that are looking for this coming spring, starting this January, all the way to fall of 2026. So this is going to be most relevant for the people that are looking at maybe this spring and fall. But as someone from admissions, I wouldn't be doing my job if I didn't tell you a little bit more about admissions and scholarship process. In order for you to apply and get accepted into these programs, you do have to apply and be accepted into the university first. So our online application at Newman is completely free. It takes maybe 10 minutes to apply. As part of the admissions process, we do not require an essay, a personal statement, or recommendation. So it really is 10 minutes. Once you've applied, first-time students, we require that you have at least a 2.25 high school GPA. If you have a weighted GPA, we typically take that or whatever's highest on your transcript. You do need to have your high school send an official. It can't come from you. And then we scholarship you. You can see our ranges here. And we do list GPA and ACT because we are a test optional university. If you happen to send us both, you don't have to, but if you happen to send us both, we'll scholarship you based on whichever one gets you more money. So for first-time students, those amounts range from $10,000 to $16,000, and each of those amounts is every year for up to 5 years. So take that into consideration. Yes, we are a private school. Yes, we cost a little bit more, but we have some really generous scholarship programs. And for first-time students, this is just the beginning. This is just your base amount. It starts here. We have other scholarships like our full tuition award that you can apply and compete for. We have scholarships for things like athletics, art, music, and theater, community service, and our honors program. We even have guaranteed minimum amounts if you're graduating from a Catholic high school. So take that into account. If you're interested in coming for a visit, we would love to have you. And one of the things we really, really try hard to do when you come for an individual daily visit is customize it for you. And for a lot of you, that includes a meeting with faculty or directors in your program of study. For those of you on the call that are transferring in from another college, whether it's a 2 or 4 year institution, same for you. Application is online. It's free. It's really quick and easy. For you, we do require that you have an official transcript sent from every college or university where you've attempted or earned credit. And then we take your overall cumulative GPA and we award you on a scale of $11,000 to $15,000 per year for up to 3 years. So if you need more than a couple of years to finish your degree, you can have that 3rd year. That's now our policy. For transfer students, we would also love to see you on a visit. We're not going to make you tour the freshman residence halls, but we would love to show you around and have you meet with faculty in your area of study. You've been through this before. We want to get you exactly what you need to make a decision on fit. So that is my spiel. Think about following us. We're at FlyNewmanU on all of your social media platforms. We would love to see an application or a visit from you or both. If you're interested in nursing, applications, I believe, are now open for the spring term. And then if you're looking at any and all of our programs that are presenting today, they also start in the fall. Applications will be opening January, February, with some of them closing in March and some in April. So put those on your calendar. If you'd like more information or you didn't get your questions answered or you know someone that might benefit from this, our next virtual Q&A session is on November 28th, and we'll be sending out some invitations for that as we get closer. Thank you all for attending today. Big thanks to our program directors and our dean, and have a great rest of your evening.